25% of the US population will develop a thyroid condition during their lifetime. An estimation of 20 million Americans have one form of thyroid disease or the other. Up to 60% of those with thyroid disease are unaware of the condition. A lot of my patients have thyroid disease. A few friends have it. So today I am going to discuss the most common thyroid conditions. I would also talk about the symptoms, signs, diagnosis, how to treat, and I will most certainly debunk those myths that are out there. But let me introduce myself first. I am Dr. Babs. I'm a board-certified family physician. I am the founder of Living at Your Finest company. I'm a health and a fitness coach, and I'm a woman who is so truly honored that you are watching this series, Health Exchange Chat Room. Thank you so much for your time. I truly appreciate you. I would like to request, if you don't mind, share this video with others that can benefit. All right, it's all things health related, holistic health, and there's sharing is caring, right? So share with as many people as possible. Make sure you subscribe too, so that you get an alert anytime there is a release of a video. Time to go into the chat room. We're going to hop in there and we're going to find a faithful community member that we can just find out what they know about thyroid disease. So guess who I have with us in our Health Exchange chat room? In person of my wonderful friend, my wonderful sister, Mrs. Ebun Abolarin. She is a geologist, and you should hear her sing. She's a great minister of God. She sings beautifully. So, my dear Sister Ebun, thank you so much for gracing us with your time. We're not going to take too much of it, but today we want to ask you some questions about thyroid.
Okay.
So let's start off with, what do you know about the thyroid gland?
Well, from biology in school, I know the thyroid gland is somewhere here.
Yes.
And then I know that I know majorly is responsible for the metabolism in the body, if I'm right.
Yes.
Yes. And then I know it causes goiter. I don't know, like when there's a swelling in your neck, because I had it some years back. So
okay,
I know that.
Well, thank you. Yeah, well, you said all the correct things: goiter, metabolism. So those are all the correct answers to exactly what the thyroid does. Now, other than goiter, are you familiar with some of the symptoms that you might have experienced? Maybe from experience, you can share with us what are some of those things, because some of the symptoms are just non-specific. It could be anything, but how could you tell that will nail it specifically? Can you give us some information?
I can say it because I experienced it.
Okay.
And I remember when I had it, I didn't know I have thyroid. And I was even pregnant. That's the thing. So when a doctor just looked at me, I don't know if you know him, Dr. Adeshokon, he just came, he's a pediatrician, and he looked at me, just said, "Can you please swallow for me?" I did swallow the first, the second, the third time. He asked me, "Do you have thyroid issue?" I said, "No." And he said, "Are you pregnant?" I said, "Yes." And he said, "The way I'm looking at you, I think you're going to develop a thyroid issue. But can we wait after the child, the delivery of the child?" And I noticed that before it starts swelling, mine got to the point that it swells.
Okay.
But before it starts swelling, I noticed that most times I'm feeling my heart rate, it's moving faster, and I'm losing weight.
Okay.
But I'm eating so much. Yes.
Yeah, that's classic.
Yes, and I was losing weight, and most times I would just be having some throbbing headaches. But I know that medically you're not supposed to feel your heartbeat or something. But most times I'll be hearing it and I'll be feeling it.
Okay.
And then at night, I'll just be sweating. I know that when I'm sleeping. And I think those are the symptoms that I noticed during my time before it started coming out, showing.
Okay, well, that is classic. Thank you so much for sharing that, especially from a personal note. And thank you, Dr. Adeshokon, for diagnosing and not turning a blind eye to symptoms. And so that's the point. We need to be observant of what's going on. What is different in our bodies? Was the swelling there before? What are these bumps? Very, very important that we are masters of our own health. So you really spoke about those symptoms. Some other things I will definitely dive in when I go into the discussion room, other symptoms that you would see and some signs. All right. Now I have 2 more questions for you. The next one will be, when that thyroid is diagnosed, so you go to your doctor, like you were referred to go to the doctor, and they diagnose it, and I'll talk about how that diagnosis is done, whether it's through an ultrasound or blood work. Are you familiar with some treatments? I mean, does it just go away on its own, or what kind of treatments are out there? Should people be afraid to even seek help?
People should not. No. People should not be afraid, because most times you don't even notice that anything is really wrong with you.
Mm-hmm.
That's the truth. Sometimes it doesn't come out. That's what I think I know, that they said sometimes it doesn't show, until after a long period of time, if left untreated, if I'm right.
You're right.
But I know that I did a blood work.
Okay.
And it shows that that there's a problem in it. I don't know. It's the doctor that knows the TH for something or something. Okay. So I was placed on medication for some time. I think, is it propranolol? I can't remember the exact.
Yes.
Yes, I remember though.
Propranolol was to reduce that heart rate, definitely to slow down the heart rate. But yes, there are other medications too. Mm-hmm.
Okay, they placed me on some medication and some other. So after some time, and the doctor called me. He said, with the level at which it is, he will advise me to get it out, because at that time, I don't know, the drug was working, but the swelling is not coming down. You know what I mean?
Okay.
So he said at that time, the drug can't work for the swelling anymore, something like that.
Okay.
But the doctor recommended that I have to get it out, and I did scan.
Yes.
Ultrasound.
An ultrasound, maybe.
Yes. Yeah, and they saw it, and there's another thing too that I want people to know about thyroid. That the doctor, I remember vividly, he said some of them have is it nodules or something?
Nodules, yes.
Okay, yeah. So he said those ones are dangerous. Some could be carcinogenic, that it could cause cancer. Yeah, and some could just be benign. So I remember he said that, and he said that's the main reason why when you have something like that, you do ultrasound to know exactly the size of it and what is going on there.
Right.
So, and because mine was very big, so he said, you know what, let's get this thing out, and I accepted.
Okay.
I did it.
Yeah. And so you've exactly. So medication, it could be surgery. There's another form of treatment, which is radiation, which I will talk about when we go into the discussion room. But yes, you're absolutely correct. But do you have any questions for me? I really do appreciate your time with us. I wanted to give you an opportunity to, just ask me any questions that I can debulk when I go into the discussion room.
Yeah, because when I did mine, I was placed on medication, levothyroxine.
Okay.
And the doctor said you'll be on it for life. And the thing is, like, I have to take the medication first thing in the morning and wait an hour before I eat.
Yes.
So I want to know if I truly, as an African, I have to be on that medication for life. But when you hear like, oh, you have to be on medication for life, you'll be like,
I know.
So I want to know that truly, did I have to be on medication for life? Like, is it true? Yeah.
Okay. All right. Very good. I'm happy to answer that. And I'll give reasons why or why not. Any other questions?
Yes. And the other question is that when the surgery was done, the doctor, because the doctor was a very good man, he did explain everything to me. So he told me that when thyroidectomy is done, I don't know what it says, what produces calcium or something in the body. They're like embedded, they're very close together.
Yes.
So part of it is being scraped off.
Mm-hmm.
And then at that time, it means your calcium will be low. So And when you feel that you have like a tingling in the side of your lip or something, you have to dose up on vitamin D. Then it means the calcium is low. That with that thing, you have to be using vitamin D constantly. And as you're getting older, because of is it I don't know,
Menopause?
as you're getting older, like because of bone. Oh,
Osteoporosis.
okay, thank you. So you have, so you have to be
Okay. All right.
vitamin D. So that is I need to ask that, is it true? Do I have to wait till when I'm feeling the tingling? Do I have to just keep on taking my vitamin D daily?
Okay. Those are great questions. Thank you so very much. I really appreciate you. You
Thank
have
you
been
for
such an
having me.
engaging community. So yeah, so I will definitely debunk all those questions that you've asked. So make sure you come back and listen to the full episode of
Okay,
thyroid disease. Thank you so much.
thank you, my doctor.
And by the way, I'm so pleased that you said your doctor was a great doctor. He explained
Yes.
things to you, and see how you're empowered. You're an expert already on thyroid disease. So I'm really happy. All right, well, take care.
Yes.
The thyroid gland, so we have two, right and left, uses iodine from the food to make thyroid hormones that regulate the way our food uses energy. There is a gland called the parathyroid glands, which are above. There are four tiny glands located behind the thyroid glands. And the parathyroid glands produces a substance known as the parathyroid hormone that helps to control the amount of calcium in our blood. Now, the thyroid gland that I just referred to, which sits in our neck, like my guest said, it's a small butterfly-shaped gland that is at the base of the neck, just below the Adam apple. It produces the thyroid gland like a hormone, as I said, which promotes growth, cell repair, and metabolism. We always hear about my metabolism is low, it's too high, it has to be my thyroid. Well, I'm going to dive in a lot more so that we can have an understanding of what's going on. Several different disorders can arise from our thyroid. The hormones that it produces, it could either be too high or too low. And there are four common conditions for the thyroid. We have Hashimoto, we have Graves' disease, we have goiter, and we have the thyroid nodules. And I'm going to dive in starting with the hyperthyroidism. Okay, so in hyperthyroidism, all it means is that the thyroid gland is over secreting, it's producing too much hormone, so its metabolism is so wrapped up, so you, like my guest said, you have your heart beating too fast, you're always eating, all of that is going on, you're just hyperactive, pretty much is what they say. 1% of women tend to have this hyperthyroidism, less common in men. Now, Graves is also a manifestation of hyperthyroid hormones, and this is the most common type. It affects 70% of people with overactive thyroid. Now, on the other hand, the nodules that you could have in the thyroid glands is another way. It depends on how it presents. It could either overpresent thyroid hormone or it could under. It could lead to the goiter that you hear some people talk about. And it could just be the multinodular glands which overproduce hormones. Now, all these symptoms are really about the same, except the Hashimoto, which I'll talk about when we get to low production of thyroid. Now, how do you diagnose this? Blood test, as my guest said, blood test is the number one way where they check your TSH, they check your thyroid levels. There's a T3, T4. You would hear your doctor talk about that. They could also do an ultrasound. If your neck is enlarged, sometimes that could give a sense of what's going on. Goiter, the eyes seem to be bulging out. Those are some indication that there's something going on with your thyroid. So you definitely want to talk to your doctor about this. Now, in terms of treatment, definitely is to reduce the oversecretion of the thyroid. There is an option of surgery, so taking out that gland that is causing the oversecretion. There's also radiation that can help to, get rid of all that excess secretion going on. So those are the treatment modalities for hypersecretion. Now let's talk about hyposecretion of the thyroid gland. All right. Now, this is when it's underactive. It doesn't produce enough to repair cells to help with your metabolism. And this is 1 to 2% of people worldwide, and it's 10 times more likely in women. Now, this can another way that this presents in hypo is the Hashimoto, as I mentioned. It could be caused, the low thyroid could be caused by Hashimoto, it could be surgery. So those that were hyper, you take it out, they now become hypo. So that's why they would need to be on lifelong thyroid hormone replacement in the form of levothyroxine, as my guest mentioned from her own personal experience. In the United States, it's estimated that 4.6% of people 12 and older tend to have just some form of low thyroid problems. Now, what are those symptoms? They're the opposite of hyper. So everything is so slow. They're fatigued, they have dry skin, their stools are slow, they're constipated, they could be moody, they could gain a lot of weight, because everything is slow. The heart rate is slow. That's why you hear a lot of time people say, oh, my thyroid must be a problem. My metabolism is so slow. I'm not eating much, but my metabolism is slow. So you definitely want to talk to your doctor. The same form, they will do a blood test, see what's going on. Your thyroid, TSH, whenever it's low, then your glands are trying to hyperproduce, so your TSH will be high, which is opposite of when it's hyper. The TSH is low because it's like, it's too high, I don't need to do much work. So you need your doctor to help with the interpretation, but just be well informed so that you can ask the right questions. So these are this is what you find with hypo. The TSH is high, and then the T3 and T4 are low. Okay, so those are the things to look out for. Now, Hashimoto, which again I said is one of those ways that is hypo. This is most common form of hypothyroidism. It affects about 14 million Americans. And it can occur at any age, mostly middle age. And the disease tends to occur when the body's immune system is mistakenly attacking its own thyroid gland. I know, isn't that crazy? That's what happens. So again, some might not have any symptoms, but if they do have symptoms, it's just going to mimic low thyroid in the body. So constipation, always cold even when it's hot. They could have thinning of the skin, dry skin. So all of those symptoms tend to occur. Same way to diagnose it, the blood test is done. Let's talk about Graves' disease. Graves' disease was named by the doctor who first described it over 150 years ago. And it's the most common form of hyperthyroidism. It affects about 1 in 200 people. This is where an autoimmune condition, it's a disease that affects the body's own immune system, mistakenly attacks the thyroid gland, so it makes it overproduce. And this disease is hereditary, right? It can develop in men, females, but it tends to be more in females, between 20 to 30, according to the Department of Health and Human Services. Other risk factors could be stress, pregnancy, smoking. Remember that my guest had mentioned they found out that she had the Graves' disease when she was pregnant. So those are some of the things, because it just really makes the thyroid gland overproduce, and the symptoms are just the same as hyperthyroidism. They would have anxiety, irritability, fatigue, hand tremors, palpitations, heart beating. So that's the same way. Again, they could find that they have a large mass in their neck, physical examination, which you would need to do an ultrasound to confirm. In terms of treatment, Again, this will be beta blockers, so things that will slow down the heart rate, slow down anxiety, slow down sweating. It'll be anti-thyroid medications to prevent the thyroid from overproducing in excess amount. Radiation, radioactive iodine, has been known to destroy all or part of the thyroid. And surgery, last but not the least. But again, remember that if you have surgery done, most times you're going to need thyroid replacement to help with with the fact that they've taken a big chunk of your thyroid, and you still need the thyroid glands, right? You still need the thyroid hormone. Okay, so those are the examples. We've talked about goiter, right, which is the enlarged. We talked about Graves, which is an autoimmune. We talked about Hashimoto, which is also an autoimmune, where it's attacking and it's a low, it's a low presentation. Now, the last one I want to talk about is nodules. Very important that we know about nodules. So nodules growths can come in one form or the other in the thyroid gland. It affects about 1% of men and 5% of women. Some of these nodules could be cancerous. All right, very important that we know that. It could be cancerous. So we need to make sure we talk to our doctors. It could be benign or cancerous. All right, so a few things to be aware of. How does the thyroid cause cholesterol problems? So it's very important. And sometimes your cholesterol could be high just because of a thyroid problem. The reason is because our body needs the thyroid gland to make cholesterol and to get rid of it. So not just make it, but get rid of it. So when our thyroid hormone levels are low, the body cannot break down and remove the LDL, which is the bad cholesterol. I do have a video on cholesterol, so make sure you check it out after this video. And so it doesn't break it down effectively. So we have high levels of cholesterol. And unfortunately, that buildup in the bloodstream can cause a heart attack. Now, the thyroid hormone levels don't have to be very low to increase your cholesterol, but you have to be certain that it's not because you have a thyroid problem that you have a high level of cholesterol in the bloodstream. We also need to be very aware about foods that we can eat overall, especially for hypo, because the metabolism is already low and you are getting replacement levothyroxine, which is never the same as what your body naturally makes. You have to be very careful in terms of making sure, like everybody else, needs to eat a balanced diet. So your balanced diet must have, your reduced processed foods, good fats. You want to stay hydrated. You want to make sure that you're eating reasonable veggies portions as well as fruits. Those are healthier ways to eat. All right, so it's very important. There are some things you have to also be very careful about. So, like for instance, you heard my guest talk about calcium. Remember, I said the thyroid glands that help with calcium absorption. When it's taken out, which most times happen when they take out the thyroid gland because it's so close to each other, you are going to be low in calcium. So you want to make sure that you're taking calcium, but under the supervision of your provider, of your physician. Okay, so you want to make sure that you're taking that. Now, selenium is also really good. It helps to activate your thyroid hormones that is used in the body. So you have to make sure that you have those essential minerals. You also want to make sure zinc. Zinc is also one of those that help the body to activate thyroid hormone. You want to ask your physician, how much do I need to take? Are these supplemental things that I need to take? You want to make sure you're not deficient because you want to be able to maximize your own thyroid glands, right? By producing proper thyroid hormone that is needed for the body. Now, some things you need to be aware of, okay, that are called goiter genes. Goiter genes are things that can just increase high levels of thyroid, hormone in your bloodstream. So definitely iodine, you have to be careful with that. You also have to be careful with soy. I know soy is one of those. The reason why you have to be careful with soy is because things like tofu and soybeans flour, they're high in protein and they're low in fat and rich in nutrients. However, for female hormone estrogen, it can interfere because it contains these things. Soy contains female hormone estrogens, which can interfere with the body's absorption of thyroid hormone. So the whole idea is, what am I going to eat that is going to interfere with my thyroid hormone, whether the one that you make or the synthetic one that you take in. So we need to be very mindful of that. The same reason why you heard my guests say that she has to wait an hour to 2 hours after taking her tablet in the morning to eat because you don't want to affect the absorption of the tablet. There's no point taking the tablet if it's not absorbed properly. So we want to make sure that we're doing everything that we can to help the proper absorption of the thyroid hormone that we're taking. Okay, fiber very important, but too much of fiber can interfere with the thyroid absorption. So the current recommendation is 25 grams of fiber for women and 38 for men. So ask your doctor where you fall under so that you're not overdoing it because you don't want to affect the absorption. Cruciferous vegetables. Now I did say veggies are good. Don't get me wrong. Make sure you eat your veggies, but just make sure you don't overdo it. I don't know that there's anybody that ever overeats vegetables. Everyone, they rather stay away from veggies. So I think that wouldn't be a big problem. But if there are any concerns, just make sure you talk to your physician. Alcohol does not interfere with levothyroxine. Levothyroxine is the tablet that you take if you're hypo and you're trying to replenish. What does affect the absorption and the secretion of the breakdown of the thyroid hormone is liver disease, and of course alcohol causes liver disease, so we want to be mindful of that. Gluten is a protein found in grain, and like wheat and barley. Even though it doesn't affect the thyroid function, yet some people with autoimmune disease that have celiac disease, they have to be very careful. You just have to figure out what works for you. If it's irritating you and just staying off gluten actually helps, then stay off gluten, because that means that there must be some interference or some interaction. Iron and calcium, very, very important. Both of these minerals can interfere with the absorption of thyroid hormone. So food containing iron and calcium are safe to eat, but there's some evidence that you should avoid them in supplemental form. Have that conversation with your physician so that you're on the right track. All right, so overall is really paying attention to what you eat, how you eat, when you eat it will ultimately give you a balanced health and optimal health, even in the presence of a thyroid disease. So I just touched on the surface of thyroid disease today with the goal for you to speak to your provider if you have any concerns about any of the symptoms that I talked about. You are your best advocate. So you're informed today, you can be transformed, and you can triumph as a health champion. So don't forget to subscribe and hit that bell so that you're, prompted whenever there's a new video on all things health related. I would love to hear from you and just get some intake about how you're maximizing your thyroid health. Until next episode, remember, you need to live at your finest holistic health because you deserve it and you most certainly can achieve it. Have a fabulous living at your finest week.